guys and dolls, divinedivak here, and today I would like to talk to you about my radiation therapy. I haven't felt like videoing in a while, and as you can see, I have my natural hair out, what I have, the growth that I've had in the past 2 months. Radiation therapy. If you're interested in finding out how I fared through radiation therapy, please continue to watch. If you are going through radiation therapy, tell me how you are. Comment below and let me know how it's going for you, because I'd be interested in seeing what you're experiencing. If you haven't seen any of the other videos in my cancer journey, please, I don't remember where it is because I haven't videoed in a long time. I'll put it in the card above a playlist so you can see exactly from beginning to end my cancer journey. But today I'm going to talk to you about radiation therapy. So, radiation therapy. Actually, of everything that I've gone through, it has probably been the best, because I really, other than a little bit of nausea, I really didn't have any side effects. I mean, yes, my skin got a little darker, and I've had every once in a while a periodical pain in my chest, but I think part of that is just healing from surgery. I don't really think that the radiation itself has done anything that I can tell you. I'm not necessarily tired, I'm a little lethargic, but I have been off work for a long time, so I think a lot of that lethargy is just not having a place to go every day and having to be somewhere and having to do something and having to think about something other than me healing. So a lot of this I'm talking off the cuff. I don't know how much of this is going to make it into the video, but I'm just going to turn on the video and talk to you and let you know how it was going. I am now almost finished with radiation. I had 16 treatments to the whole breast, and then I have 4 treatments that are targeted where the tumor was. So I have actually completed my 16. So I've pretty much gone through most of the radiation, and then next week I'm going to finish it off with a target specifically at the tumor, where the tumor was. It's not there anymore. Where the tumor was, and that will be the end of my radiation. Let me show you what I used. I used emu oil, 100% pure organic emu oil. And I use this every morning and every night. And in the my morning and night ritual was that, and then Aquaphor. Got myself a big old jug of Aquaphor. I think I got this from Walmart. I got this from Amazon. And when I went to actual radiation, after the treatment, I would put lanolin, and I'm sorry, I left the lanolin in the car, but I also got 100% lanolin from Amazon. I had heard about, you know, if you're at this point in your journey, you probably watch lots of videos of people who have, you know, telling what they've gone through and what they've used. So early in the journey, in my research, I saw people talking about emu oil. This isn't cheap. I'll say it's not cheap, but actually I've gotten through 16 treatments and I'm here. So I got plenty of emu oil left. I'll have plenty of emu oil left. And I will keep treating the area probably for 2 weeks after radiation is over. And then after that, I'll put it in my hair as my hair grows. This emu oil is very good for your hair. So when I went to radiation and I saw the doctor, because you see the doctor once a week. When I saw the doctor, she asked me what I was treating my skin with, because my skin looked really good. And I said, well, emu oil and Aquaphor, because Aquaphor is what they told me. Aquaphor alone is what they told me to use. And she goes, emu oil? She said, they used to talk about that, you know, a long time ago, it is very good for the skin, but most people just didn't want to pay the money for it. They couldn't afford it. And my thought is like, you know, I've seen some of those pictures of people with their skin all burnt up, and it's like, I'm not doing that. I'm not doing that. If I have to, you know, save a little money and get something that will actually work, that's what I'm going to do. So I did opt for the emo oil. I'm very happy I did. The lanolin, I had two lanolin. I had liquid lanolin, and then I had like a gel lanolin. Probably halfway, maybe 3/4 through the treatment, I lost the liquid lanolin. I don't know, you know, where. I thought I left it at the radiation center, but they said no, I didn't. But I used to keep it in the pocket of my coat, change coats, and somehow the liquid lanolin is gone. But I also had a jar of cream lanolin, and so I ended up using that, because that's something that I'm not going to forget. It's a big old jar. I keep it in the car, although as cold as it's been here, it's really, really difficult to emulsify it, to get it on me. Take a little bit longer putting it on after the treatment. But from a radiation standpoint, I can't say that I really had many side effects. Again, a little nausea from time to time, nowhere close to the nausea that I had at AC, or with Taxol. So one of the things that they said was that if you had any any nausea medicine from there, then take that. But the nausea never really got that far that I felt that I really needed to take medication for it. Let's see. There's really not a lot to say. I'm excited that my hair is finally coming back. It's coming back straight, which is, let me turn around. I don't know what you're going to see, but it's coming back straight as opposed to curly. A little disconcerting, but it's just coming back. So I've heard that the curl will come back as more hair comes in. So, but it's winter here. I've got plenty of wigs. You're going to start to see some wig videos coming up on my channel. I think they're all gray, so they'll be in my gray wig series, which I will put in the cards. I have a playlist for that, and I will put it in the cards. Let's see, what else can I say? I mean, I have a lot of white hair, but they say your hair will come in a different color. I always had white hair on my temples, so I'm expecting that this white hair that I have here is probably going to stay. The white hair that I have on the top, I had more black hair up on top, and it's kind of different to feel hair on my head, because for so many months it was bald, it was skin. It was like feeling your forehead. You know, feeling your head was like feeling your forehead. And I'm like, this feels really weird. And so now, you know, with the fuzz of the hair coming in, it also feels different. I have plenty of hair products to put on it. It was funny, I was telling my sister this morning that I actually put conditioner on my hair, and I felt the conditioner. So that was really nice to be able to feel that on your hair. But the process of radiation therapy. You go into a room with a big kind of machine, and there's a table there. And on the table there's a sheet and kind of like a mold. So the first day that I went for my radiation consultation, they had me in a CT room, and they created a mold. So I had my hands over my head, and they created a mold of me with my hands over my head. So, and then they kind of looked at where the breast was, and they took some measurements. And so that was my very first visit into radiation therapy. Then when they actually go for the therapy, you go into this room, it has your mold, you get into, you have your gown on, take your arm out your gown, you go into the mold, and that's when they align you roll you, you just lay there, they roll you, they position you. They used to do tattoos, but they don't do tattoos anymore, at least mine doesn't. And I'm not quite sure how they see, spatially, how they see where you are, because they have to hit the same place every time. And so I don't know how spatially they figure that out, but they do figure out spatially where you are. And they line you up, and there's lights that come from the ceiling that, like little laser lights that are on you, and they kind of figure out where you are in relationship to that. And usually takes between, I would say, 2 minutes, long 2 minutes, a minute. Sometimes it took them like a minute to get everything lined up, and then they leave the room, and then they speak to you over a loudspeaker, and they tell you to take it in, what they call it, you can take a breath in, which is called an inspirational breath. So you take the breath in, and you have to hold it, and what that does is it pulls the breast tissue away from the heart, because they don't want to radiate the heart, because that could damage the heart. So you take what they call an inspirational breath, and it pulls it away, and then they hit it with the radiation, and then this big machine rotates around you, and it just does that. And the whole procedure takes maybe a minute and a half, 2 minutes. So my whole appointment was 10 minutes, maybe long, 10 minutes. So it was really strange, because I had to drive a half an hour for a 10-minute treatment, and I had to do that every day. So it's kind of time consuming, and the rest of the day you don't do anything. Well, I didn't do anything. I didn't go to work, because I had no idea how I was going to react. So since I had the ability to take the time off, I continued to take the time off. I didn't go back. So that is what was going on with radiation therapy. That was the process. I'm glad I'm finished. Now it's on to the monitoring stage. I believe I see my oncologist next week, so we're probably going to go over what's happening. My understanding is that the monitoring phase is that I have a mammogram and then an MRI, and then a mammogram and then an MRI, and every 6 months. That's how it's going to go for the next couple of years. Obviously I don't know if I'm seeing the oncologist every 3 months or after every treatment. I don't know. I mean, every, mammogram, or after every MRI, I don't know. I don't know why I need to see her that often, because when I go, she doesn't do anything. I mean, there's nothing to look at, there's nothing to feel. I mean, the suture, I mean, the scars are there, but they're healed. I could have a telephone call with her, and that would be, but I also have to drive 90 minutes to see her, or not 90 minutes, let's get that back, Kate, dial it back, 60 minutes, about an hour to go see her for about 15 minutes, and then drive an hour back. It is what it is. But other than that, I feel very blessed. I'm very healthy. I'm very happy that I'm on this other side. When I first got diagnosed, I thought, oh, the road in front of me is just so long. And the reality is, it's almost, in terms of treatment, I got one more week and then I'm done. It flew by. When I was in the midst of it, like AC was hell. One step in front of the other was what I did. One step in front of the other. I just drudged through it. But on this side of it, I'm like, oh, I'm so happy that I'm cancer-free, and I'm looking forward to what God has for me in the rest of this life of mine. If you or anybody is actually going through their cancer journey, comment below where they are and how they're doing. I would love to have dialogue here about that, because I was craving videos. When I was diagnosed, I was craving videos. Very important to see, what I was in for. I knew that everybody's experience is different. And so not everybody's going to have the same experience, and I understand that. But it was good to know what might happen so that, when it did happen, I wasn't shocked. So I really, really enjoyed that. I know I wondered sometimes why the people that I was watching weren't making videos. I mean, they made videos for a while, and then they just kind of stopped, and then they started again. And then now I see, because you go through a period. I mean, I will tell you, you'll see on my channel, I didn't feel like making any videos. And when in terms of my hair, I have come to accept the fact that I am, my hair is coming back, so I guess I'm on the other side. When it was completely bald, I did not feel comfortable getting on camera and doing anything. And my head was still kind of sore, so I didn't really want to wear wigs if I didn't have to. So I just wasn't in the mood. I just, couldn't get the energy up to do that. So now you'll start to see more videos from me. I'm not quite sure what order I'm going to be putting them up in, because I also have to edit all of these videos. But if you've made it to this point in the video, then I know you like my content and you're interested at least in my cancer journey. So comment below where, if you're on a cancer journey, where you are in your cancer journey, and share this with anyone that you know who is currently diagnosed or currently going through a cancer journey, just if they haven't gotten to this point, to see another person's experience. I will see you in my next video.